The Scholars in Ethics and Medicine program is a really unique program offered by the Hyde Park Institute. It's geared towards undergraduate students who are at the University of Chicago who are interested in going into medicine, so our pre-medical students, as well as medical students here at the Pritzker School of Medicine, usually first or second year medical students before they've started their clinical rotations.
It's a program in which we come together and we hear different speakers who show us both by the ways in which they've done research and thinking, but also in the ways in which their own practices and lives, they've taken this concept of virtue ethics and virtue and applied it to the care of patients to show us how we can do that in our own lives to make medicine a better profession.
Something that's unique is the diversity of perspectives that are brought into the space. I like that it's a small group setting, so we are able to really have those conversations, and it's not just lecture-based. We do have an opportunity to have conversations with the lecturers, with each others, and take a deep dive into these issues, and I really appreciate that.
There's a big focus on the moral traits and characteristics that a physician would best emulate. So thinking about things like honesty or courage, and how do you use those virtues in difficult clinical situations.
We had a pediatric palliative care physician that came in, hearing her talk about caring for children who are dying and their families and how difficult that is, but how she, with kind of a virtuous and moral foundation, was able to deal with that and then also to help guide families and children through those experiences. That was a really impactful lecture for me.
Going to the talks has been wonderful, but also being able to engage with the physicians after the talks and really speak with the other students in the program as well, both the undergraduates and the medical students. I'm always so impressed by all their questions and their thoughts and their reflections. They're always able to kind of challenge both what the speakers are saying, but also what other students are saying, and engage in kind of a really meaningful dialogue that's kind of pushed me to understand that, there's no one right way to be a good physician. Kind of being able to have that cohort and that group dynamic has really helped me see the different perspectives on a lot of the issues we're talking about.
Cultivating your character takes time, and it takes a community to do so. And so one of the great things about our course is that we take that time while students have that time. Our hope is that we prepare them to be good physicians, but the skills, the interpersonal skills, the morals, the virtues that guide their daily decisions and their daily practice as a physician have already been instilled in them.